everybody, Carrie Koziel here, women's health specialist, postnatal Pilates specialist, and I wanted to do a video on lubricants. And I think it's funny because I'm sitting in the car waiting for my son to finish his little sport, and the lady in the car next to me is waving to me. She probably has no idea that I am doing a video on lubricants, but here we go, because this is an under-discussed topic for postpartum women. After you have a baby, you have a complete nosedive in your estrogen. And estrogen is a plumping, juicy, lubricating hormone that's very protective to the pelvic floor region. So you may be prone to a little more dryness down there with sex after you have a baby. The other thing is breastfeeding can lead to dryness as well for some hormonal reasons, but also because this area may have been a very, now I'm just touching my boobs for her to see. But this area may have been like a very nice erotic area to help preheat the oven and get your juices flowing a little bit. And if you are currently nursing, most women find this to be now like a hands-off area. They don't want anyone touching that area, looking at that area, a hairy chest rubbing on that area, anything. So you may have to have sex with a bra on for quite some time after you have a baby, and just talk about this with your partner and know that these once again will return to being an erotic area for you, so hang in there. But that means you're going to have to use lubricant to decrease pain and friction and the possibility of tearing during intercourse. So lubricant goes on you, in you, and on anything that will enter you, whether that is a penis or a pleasure aid or toy of some sort. Now, when it comes to the different categories of lubricants, there's three main categories: water-based, silicone-based, and oil-based. Let's start with silicone-based because it's probably my favorite, and it's a little pricier, but silicone-based are very nice because they're long-lasting, they're condom safe, and they dry to this like silky powdery finish, which is actually really nice, rather than some of like the gunky sticky finishes of the other lubricants. I like to think about silicone for what I call marathon sex, which is really anything over 10 to 15 minutes in a postpartum woman. So check out silicone. I think you'd really like that. The only disadvantage is you can't use a silicone-based lubricant with a silicone toy or pleasure aid. They will break down the particles in the toy. So file that one away. Next is water-based, and this is probably the most common lubricant. This is what the KY jellies and all the other things are made out of, but you have to be really careful of the ingredients in those lubricants. You're looking for lubricants, water-based lubricants that do not have glycerin or paraben in them, because that can be really irritating to the vulvar surfaces. And then the final category is oil-based lubricants. So women will ask all the time, can I use an olive oil or coconut oil from home? The answer needs to be, what is your method of birth control? Because if you are using condoms as a method of birth control or STI prevention, then certain oils are going to break down. Oils will break down certain condoms, specifically latex and polyisoprene condoms. So that's the Lifestyle Skin brand, are not compatible with oil-based lubricants. So be really careful when you select an oil. The nice thing about an oil is that if you think about getting oil on your hands, like in the kitchen when you're cooking, it's hard to rinse clean. So you kind of have to use soap and warm water and really try to get the oil off. The same is true for oils in the vaginal area. So they can really coat the walls of the vagina, which is a good thing. They can be, last in there a little longer. But if you're somebody who's more sensitive to products or prone to UTIs and infections and that sort of thing, you might want to choose a different lubricant, because sometimes it can be harder for the vagina to flush clean the oils in an oil-based lubricant. So I hope that gives you just a little bit of information about the different types that are out there so you can select the best for yourself. And if you have any other questions, you can look at my blog posts or log on to carriekoziel.com. I really take women's health seriously. I try to educate you about things that we're just not commonly getting educated about. And I'm trying to make sure that I am giving the best information that I can in my exercise programs. My exercise programs are a combination of education and exercise. So think about taking one of my 6-week classes where I will share tips like this and so much more with you. Okay, bye.